Good morning, everyone. Happy holidays. We'll get started in just a moment. Okay, let's go ahead and get started. Good morning, everyone. Merry Christmas Eve. I'm Sunnyvale Mayor Larry Klein, and I hope everyone is enjoying the holidays as much as they can during shelter in place. Twas the day before Christmas, and thanks for joining me again this week. We decided to move it from Friday to Thursday, so I'm assuming there will be quite a few people that weren't expecting it today. But anyway, welcome. This is our 41st installment of our weekly virtual office hour address. People continue to say that they really like these live stream addresses, and hearing from their mayor, it definitely allows me to give you some updates, answer some of your questions, and provide some words of encouragement. I'll be doing this, I've done it since the shelter in place began, and I'll be doing it through the end of the pandemic, when however long that's going to take. Thank you for allowing me to continue to represent you and work for Sunnyvale, during these ever-changing times that we've had over the last 9 months, soon to be 10 months. So, you know, we'll soon be in 2021, but I hope everyone is doing well, staying healthy. Please remember to take care of yourself, both physically and mentally. These are difficult times for so many people. There's this general fatigue of staying at home, and a lot of people are looking forward to visiting the relatives, getting away during the holidays, myself included. And now I'm here where you see me every week. It's a difficult holiday season, being separated from your friends and family during a normally very festive time. So, but please, stay at home. Please don't travel. Keep following the county health orders as much as possible. People really need to do your part to stop the spread of the virus. Wash your hands, uh, don't touch your face, maintain good, safe social distance when you're out. And of course, as always, continue to wear your face mask. If you need a face mask, definitely reach out. But you know, it's mandatory. It helps. As I've said before, it's very difficult. And of course, get your flu shot. Vaccinations have started over the last week, and we're continuing to look at the priority of who gets vaccinated first. There's a whole, I think, a New York Times article on when, when you, based upon your age and your job, as well as conceivably what your health conditions are, when you'd get vaccinated. And as far as our county of about 2 million people, I'm around 1.4 million or something of that nature. But we continue to see the surge of cases. So you could be a carrier, or someone you could meet could be a carrier and not have any symptoms. And so it's really important that you do whatever you can to stop that spread of the virus. We're now 283 days after the March 16th county health order started the shelter in place in an attempt to, really slow the spread of the virus. And we were doing very well, in the spring and the summer. But the last month has really, the surge of cases in our county, in our area, and around the state and around the nation has just been, really sobering. Um, Looking at our ICU availability, looking at our hospital availability, it's a very difficult time for our healthcare workers. And I my heart goes out to them. I know several people in that work in healthcare, and it is not easy, seeing just how much, it's been a long slog. It's been a marathon to get to this point, but we're not out of the woods. And it continues to be very difficult for them. So if you know any healthcare workers, please, please give them, your best wishes, during the holiday. This is as stressful, even more stressful in the last few weeks than it's ever been before. So, since that declaration of that shelter in place and the latest shelter in place order, a lot happens. A lot happens every day. I have press conferences to watch, seminars to attend, conference calls to confer and advocate on your behalf. But we'll continue to do this. We will continue to persevere, you know, as a community. And, if you need anything, if you need assistance, there are lots of service organizations out there that are providing food, providing assistance. So, definitely, reach out if you need additional help, and I'll put you in contact with those that can help you. So let's go ahead and get to what's happened at a federal, a state, a county, and a city level over the last week or so. Last Monday, Governor Newsom was in LA for the photo op of receiving the first Pfizer and Moderna vaccines in California. And, it was basically saying that there's a light at the end of the tunnel. Um, and it was mainly a photo op, at Kaiser Permanente in Los Angeles, as we got the first doses. And last week, those first doses were given to mainly healthcare workers around the state. And so, and that's completely around the state. We started to receive them, and it depends upon whether or not the county received a certain number, but the healthcare facilities themselves received a certain number over the last week, over the last 2 weeks. And so you see, lots of healthcare workers finally getting that as from a protection standpoint, and that's the first of 2 doses. All these first doses are, it's 1 dose and then a second dose about 21 days later. Last Monday, the state officially also released the long-awaited guidance for, outdoor and indoor youth and recreational adult sports. So it was mainly based upon, the 4 levels, the 4 tiers of purple, red, orange, and yellow. And so the most restrictive tiers are mainly all outdoor activities, biking, golf, tennis, and making sure that you're not interacting with people from outside of your bubble. And then the red tier was mainly moderate contact sports outdoors, so baseball, softball, dodgeball, gymnastics, lacrosse, all that outdoors. And then from the orange tier, you're finally starting to allow indoor sports. So for an outdoor, it's more higher contact stuff from basketball, football, soccer, and then indoor starting to allow basketball, boxing, ice hockey. And then at the yellow tier, you're finally starting to see, indoor high contact basketball, boxing. Anyway, and then last Tuesday, Governor Newsom had his standard press conference and talked about ultimately those vaccines being delivered to our healthcare workers and what the total number of cases were. And the first phase of the vaccine rollout, we should have got around 3 million cases or 3 million doses, and it's all for healthcare workers and long-term residents at long-term care facilities. The second phase will start including teachers, farm workers, grocery store workers, but that'll be a month or so before we really start seeing those second tier cases, those second tier doses. And let's see, from and the governor gave the standard daily dose counts or the daily case counts from a COVID standpoint, the number of people who had died, and that continues to go up, and then just raising the flag about rationing care. The ICU availability around the state has continued to drop, especially especially in the South, in Southern California, Central Valley, now the Bay Area, Sacramento area, the north. The very north of the state is about the only one that isn't really hit from capacity issues right now. Just in general, the Southern California and San Joaquin Valley has been sitting at 0% for several days now, and it's difficult. And the governor also talked about activating mutual aid for coroners, because our coroners aren't able to handle the upsurge in the number of deaths due to COVID. And so that activated, getting 53-foot refrigeration trailers, as well as, just 5,000 body bags in case, our hospitals and coroners can't deal with the actual number of dead people that have basically been affected by COVID-19. So, it is difficult times, and the message this week was pretty much the same. But we'll get to that in a second. Last week the county supervisors also met, and they enacted a cap on food delivery fees. So this is, and this has been talked about for about a month and a half now. But it's capped. It put a cap on 15% on the cost of an order. So the delivery fee can be up to 15% of that order, and it will last as long as the ban on full capacity indoor dining remains in effect. So I really appreciate Supervisor Chavez and Supervisor Simidian for introducing that proposal and pushing it through the supervisors. This immediately this took effect last weekend in all 15 cities and the unincorporated areas of the South Bay here, unless the city enacts a more restrictive fee cap. So I've heard pluses and minuses from that standpoint, as far as the restaurants, that the different food delivery services have been a little, let's say, dragging their feet a little bit on how this has been implemented, and looking at ways of basically circumventing that to some degree. So we'll see how that goes. But I've raised this issue with the county supervisors, and hopefully, in the past, I've heard from restaurants that they're having to pay 30 to up to 50% of the cost of the meal goes towards the delivery service. So if you're supporting your local restaurants, and I hope you all are, definitely do takeout as much as possible, and go there. You can do contactless takeout very easily, and save the delivery fees from the restaurants themselves. And then last Wednesday, the state announced that the ICU capacity had fallen below 15% in the Bay Area. So said that we would not. So the Santa Clara County had already been in put more restrictive measures in place. But as of last Friday, the entire Bay Area had fallen below 15%. And so that put into effect no indoor dining, closing all of the service uh, um, retail like barbershops, hair salons, nail salons. All of those closed around the Bay Area last Friday morning, and the ICU capacity, you know, was bad around the state. So ultimately now almost 90% at this point, 98% of the state is in that most restrictive regional area, and the last 2% up in Northern California, a very rural area, is the only area that isn't in the most restrictive regional area. On Monday of this week, at a federal level, there was a new CARES Act that was finally approved, and Congress had been working on this emergency budget package since all summer long, all fall long. So here we are at the 11th hour, and Congress approved, a $2.3 trillion spending relief bill, which was about the package itself was about 5,600 pages. So I was actually surprised that they had actually done something with so much, I'll say, pork in it from that standpoint. And it was passed through the House, through the Senate, and ultimately it had some good things. It was basically a deal that for a COVID relief standpoint, it helped those most in need a little bit. There were $600 stimulus checks for those making less than $75,000 a year. There was actually some surprise, legislation around medical bills, but ultimately, and it gave civilian workers in 2021 that work for the government, so federal pay raise of 1%. But ultimately, when it got to Trump's desk, he said that he wanted the $600 stimulus checks to be $2,000 and to go back and start working on it. We were hoping that would be approved by just a voice vote. The only way that they can do that, which may be done today, but it looks like that's going to fail. There's all kinds of issues of from a funding standpoint, it would also fund basically keep the government from shutting down. So there's all kinds of issues at a federal level right now that need to get completed. That isn't done. We'll see if it gets done today, over the weekend, on Monday. But definitely, we were hoping that there would be support for local cities and local counties. That doesn't look like that's the case. There is some state funding, but it's really difficult, and that was one of the things I've been advocating on for a while through California League of Cities, through the National League of Cities, but through the U.S. Conference of Mayors, but we didn't get that. So it's pretty disappointing from that standpoint that government bill isn't focusing on the cities that really need it, as well as the residents in those cities. So we'll see where that goes. There's been talk that even though that didn't get put into as part of that package, that conceivably that's added in a bill first part of 2021. So we'll see where that goes, but currently not there. On Monday, Governor Newsom had a press conference, and that's where he basically said that 98% of Californians, excuse me, are currently under that regional order, that 3-week stay-at-home order. And so one of the things that was no indoor dining, no outdoor dining. Basically, it's pickup only. No no retail except for limited indoor retail, no um, no barbershops or hair salons, no nail salons, all that couldn't be open. And the positivity rate for COVID-19 in the state had went up from 8% about 2 weeks ago to 12%. So the number of new cases just keeps rapidly increasing, and hospitalizations increased 63% over the last 14 days, and ICU rates have increased by 50%. So our ICU beds have rapidly been filling up. Our regular hospital beds have been filling up, and from that standpoint, the from a Bay Area standpoint, you know, we were our number of ICU beds is under 10%, and that to me is very difficult, showing that as much as we can do, um, uh, it the COVID-19 pandemic continues to spread in our community, and people are getting sick, people are being hospitalized, people are dying, and the governor said he wouldn't lift those stay-at-home restrictions until all 5 regions are out of that 15%. So it's not just, initially it was going to be when those regions went, the ICU beds went above 15%. Now those restrictions are going to be there for a lot longer. So we'll see if that changes, but right now, that's very difficult from a state standpoint. And then on Tuesday night, council met at a special meeting, and so we thought our last meeting was going to be 2 weeks ago, and we try to have it the first part of December. But two things came up. One of which was fairly simple, was the Public Safety Officers Association finally approved the negotiated contract change for the next 4 years. So that was approved, and there were some minor changes. The public safety officers' pay increase is all based upon CPI and kind of comparables between other public safety officer organizations. So a lot of that is taken out of that contract, but there were certain changes that were required. Looking at things like how often they purchase boots, how long, what percentage of additional, what percentage of pay increase they get for certain training. So there are things of that nature that depending upon what training they get, what their op jobs are, what overtime is, how overtime is handled. Those are negotiations that seem to happen every time there's a contract negotiation, and that was approved. Fairly simple. Actually no one even spoke on that, so that was actually a very quick item. But a good portion of the evening, over 2 hours, was spent on looking at an emergency ordinance to delay the minimum wage increase. And so when this ordinance was approved about 4 years ago, just actually about 5 years ago, council basically set a time frame to go up to $15, and then past that, every year the minimum wage would increase based upon the CPI, the Consumer Price Index, every year. And so back in October, and we've talked about this, back in October, council approved going ahead with the minimum wage increase from $16.05, which it is now, to $16.30. And ultimately, there was a lot of lobbying at the beginning of December when the region, well, when the county especially, but now the region, went into that lockdown. And so there was a lot of lobbying to council, and several council members basically agendized bringing forward a delay of the ordinance for a minimum wage increase from $16.05 to $16.30 until later in 2021, when either a specific date, or when restrictions were finally let up. And a lot of people spoke for the delay. A lot of people spoke against. In many ways, it was a lose-lose situation. We want to help our working residents, especially those that are working at minimum wage, and we also want to help our small businesses that are really the lifeblood of our community. And so from that standpoint, the minimum wage, the big thing is our minimum wage as it currently stands applies to everyone, whether or not it's a big business or a small business. And we couldn't, in the short term, try to carve out that, okay, if you're a business under 5 people, 5 employed people, yeah, you don't have to do an increase or something of that nature. And and those people working at those small businesses are working often at minimum wage. So it was a very difficult decision, and when council approved that increase, that CPI increase, it was pretty much a contract with our residents and our employees and employers that this is what would happen on a yearly basis. And I can understand those restaurants and our Chamber of Commerce that spoke for that delay. They are hanging on by a thread, but at the same time there are residents that are also that $40 a month, and that's what it really comes down to. 25 25 cents a day, or 25 cents an hour, comes to about $2 a day. uh, about, when it comes down to it, $40 to $50 a month. There are residents that will make a big difference on. And so, it's very difficult, and it will definitely make it harder for businesses. Although some businesses have reduced only to 1 person, 2 person, and it's only the family. It's a family-run business, so it's just the family running that business. So you know, we ultimately, unanimously decided not to postpone, not to delay that increase. But it wasn't difficult. It was very difficult and wasn't easy from that standpoint. So, whatever you can do, please support your local businesses. Do take out, tip well, whatever the case is, because people really need it. Your businesses really need it. It's holiday season. Buy gift cards. That's one way to immediately help those businesses meet their bottom lines on rent. I know a lot of businesses didn't get any rent relief, and so what we also did from like a city standpoint, about a month ago, was delay the business license tax. So the yearly business license tax that would normally come due December 31st, we delayed that to the middle of the year if businesses have been hit by COVID. So those businesses that haven't been hit by COVID can go ahead and pay. If businesses have been hit by COVID, then definitely they can delay that. So and it's a difficult time. This would normally be a time when especially restaurants would be having a lot of holiday patrons, parties. There, do takeout, continue doing takeout. That's one of the things I've been pushing for since the beginning of shelter in place. Most of you probably read the Sal Pizarro article that was in the Merc last Friday, or you might have heard the KCBS radio interview that I had last week. It's highlighting those restaurants and highlighting the variety that's in our community is really good. But there are a lot of restaurants and a lot of people that are hurting right now. So if you can, do take out 2 or 3 times a week. It makes a difference in these restaurants, as far as these restaurants are concerned. And then let's see. Also on Tuesday, Governor Newsom announced his replacement for Senator Harris as she moves to her new role as vice president. So the governor chose Secretary of State Alex Padilla to fill the Senate seat, and then he also chose, and Alex Padilla will be the first Latino in state history for that role. So that's actually very important, and kind of represents how our state has changed. And then he also chose Democratic Assembly person Sally Weber to then fill the Secretary of State position. So I think and he had been lobbied, the governor had been lobbied by a lot of people from that standpoint, to choose either a black woman or choose basically a Latino Latinx person to basically represent the state, from a Senate standpoint, and so the governor has, some hard choices to make, and I don't envy his position from that standpoint, but I think I've heard our Alex Padilla speak multiple times, and I've actually been impressed with his presence and how he basically helped through the whole voting section this past year, dealing with the pandemic and trying to make sure that mail-in voting worked well within the state. And so I you know I I'll see let's see how he does at a state level. And then yesterday, the Santa Clara County Health had a big press conference, and it was mainly begging people not to travel for the holidays. And we've been seeing an increase in flights and travel outside of the Bay Area during the last 2 weeks. And personally, we canceled our holiday plans a few weeks ago. Yeah, even though I was really looking forward to getting out of California for the holidays, like we do every year. It's difficult being on council. We don't have. Some councils take the summer off. So we by charter have to have 2 council meetings every month, and so it's difficult. And so the holidays are often the only times that you can get away. There are a few times in the year, but you have to be planned. Very, very difficult. And then often because of intergovernmental meetings, you don't really have a chance to get away. You still might have to call in or have your alternate be there. So a lot of those meetings aren't canceled during the summer. So I was really hoping that after a very difficult year, we could finally be able to get away, and that's not the case. And I understand that that's in everyone's best interest right now, in my best interest. And setting a good example for our residents is, to me, really important. Making sure that the hardships that they're going through, we're following the same thing. So I'd really like to have gotten away, visit some family, some of my newly discovered family, but that's not the case. So I'm looking forward to next year and seeing and getting the vaccine, getting a certain amount of herd immunity, and being able to see loved ones again, hug loved ones again, and enjoying a different locale as much as I love Sunnyvale at the end of the day. So let's go ahead and get to the health dashboard. On testing, on hospitals, on from a state standpoint. Actually, from a national standpoint, we've now had over 18 million cases. That's up, over 1 million cases just in the past week. And from a California standpoint, we've now passed 2 million COVID-19 cases. So we're the first state to actually pass 2 million cases. We actually haven't had as many deaths as New York or Texas. We're still have had about, I think, more than 24,000 cases, or more than 24,000 people that have died because of COVID-19 within our state alone. And our ICU bed availability at a state level is about 1.1%. So, that's one of the reasons why the governor has basically said we will, not come out of those regional lockdowns until that ICU bed availability increases around the state. So far, about 128,000 vaccines have been distributed. So hopefully, the COVID-19 positivity case rate goes down, but we're still seeing that surge around the state, around the country, around our county. So from a cumulative county standpoint, we've had almost 60,000 cases, 59,900. That's up about 7,500 from last week. And last week we were looking at a Friday to Friday, so this time we're only looking at Friday to Thursday. So definitely we'll be over 6,000 or 60,000 COVID-19 cases um, tomorrow. And so it'll be back to our, we were up 8,300 last week, and 7,300 with a day to remain. So about the same number this week. So the surge continues within, our county. We've now had 632 deaths in the county. That's, up about 65 from last week. And that was up from 45 the week before. So we're having increase of ICU bed case usage because of COVID-19, the increase in the number of deaths. We currently have about 631 people hospitalized due to COVID-19, and that's up from 566 last week. So we continue, even though people are either getting better and leaving hospitalization or dying. We continue to see more and more of our beds, hospital beds, both ICU and normal hospital beds, focused on COVID-19. So it's very difficult, around the county, around the state. As for our city, San Jose now has 39,500 cases. That's up 10,000 cases just in the last week. So it's very, very, very difficult. And from a Sunnyvale standpoint, we've had 2,560 cases. That's up about 400 in the last week. And that's been, kind of surging upwards, 400, 350 the week before, 250, 175. So it's been an ongoing, increase as far as that's concerned. It's surging within our city, within our county. So, I continue to do a lot of advocating on your behalf. At the county level, I was happy to see the delivery, the food delivery cap go in place. We have testing, and we have our testing on our second and fourth Monday. So if you want to get tested, there will be testing at Murphy Park on Monday from 9:30 to 4 p.m. You can go to sccfreetest.org. I was checking 2 days ago, and there's still availability, but who knows if it's been full. If you go to sccfreetest.org, you can actually get a full list of places around the county that you can get tested, either the county pop-up van or there's several like Planned Parenthood in Mountain View that's doing testing. El Camino Hospital is doing testing. So there are a lot of places if you need to get tested, and your healthcare provider should be able to provide that if you need to get tested. Let's go ahead and talk about what's upcoming. Not a lot of events coming anymore. Where everybody's in shutdown. So from that standpoint, and we talked about last week about the Sunnyvale Community Players. They had once on an island LiveStream. They also have a Christmas concert that's going on now, so you can actually take a look at that, and that's streaming online, so you can go take a look at that. And then as far as upcoming meetings, things are kind of quiet between Christmas and New Year's. So our first council meeting of the year will be Tuesday, January 5th. And so a lot of people are asking, when they'll get to see me sworn in. That'll be on Tuesday the 5th. So we'll basically say goodbye to the exiting council members, say hello to our incoming council members, and then see some pomp and circumstance as far as the swearing in ceremonies for the different members. And then finally on that same evening, we'll be choosing our intergovernmental responsibilities. So that'll be the first council meeting of the year that will be on Tuesday the 5th. And then that's pretty much as far as upcoming. So as far as questions and comments that I've had from people, let's see, Aman commented, the city of Sunnyvale should do some decorations, especially on main streets like Santa Clara does on El Camino, Cupertino does on Sunnyvale Saratoga Road. We used to do that, and I'll bring it up the with the city manager. I know that we had some decorations, and why those haven't been rolled out, I'm not really sure. So I'll bring that up with him. There's still some time left in this holiday. I do think it adds a little bit of festivity to the time, but I understand. We're dealing with other issues, but I do think that adding a little festivity, like the holiday tree on Murphy Avenue, is a good thing that we see every year. And as far as other questions, let's see if I had anything else. Um, looks like looks like things are pretty quiet this week as far as questions. You know, definitely. Uh, it's the day before Christmas, and so hopefully people are trying to get into the Christmas spirit as much as possible. There's Zoom Christmas with their relatives. Zoom has actually got rid of a lot of their restrictions for the holiday. So hopefully you can at least see your relatives and friends virtually tomorrow. If you're still looking for stocking stuffers, there are lots of things that you can do as far as Lee's Books, Bookosaurus, lots of local retail from that standpoint, or buy buy some sweets. There's Chocolatier Desiree downtown. There's several baked goods shops that I highlighted in this morning's post. Definitely go out and treat yourself, treat your friends and neighbors. Leave baked goods on their front door. Whatever you can to help the local economy, as well as kind of spread holiday cheer. Um, it's it's a difficult time for many people, and little little aspects of showing that you care really make a big difference. So thanks everyone for what you're doing. Um, I know it's not easy, but this is our holiday this year, and so thanks for joining me. I'll go ahead and wrap up. Uh, thanks for joining me again this week. I know it's uh, a little out of normal with having it on a Thursday morning. We'll do it again on New Year's Eve. So come back next Thursday. In the new year we'll go back to Friday mornings, but come back next Thursday if you can. As always, I'm proud of Sunnyvale's response to this pandemic. I know it continues to be difficult. New issues come up every week, but your actions and response does make a difference. Wear your mask when you're out, get your flu shot. You know, I know, help your neighbors however you can. It's not easy, um, but it does make a difference. Continue to build community, help others during this pandemic. I'm always proud to see Sunnyvale residents really pulling together to help their neighbors, help strangers. You know, I've gotten a lot of things left on my doorstep this week, and I appreciate that. Whether or not it's a card, flowers, what you see in the background, uh, it's really nice, and so I do appreciate that. And if you're out on a walk, say hello from a safe social distance. People really miss that social interaction, especially during the holidays. Sunnyvale really will emerge from this as a stronger community. We're all in this together. We'll get through this together. Thanks for listening, and until next week, stay safe, stay warm, stay dry. It's going to be raining tomorrow. And of course, wear your mask. I hope to see you next Thursday for Christmas Eve. Until then, take care. Goodbye.